At any moment, you or someone around you could experience injury or illness. Using basic first aid, you may be able to stop minor injury from getting worse. It is important that you have well-stocked first aid kit in your home so you can deal with minor injuries and accidents. Your first aid kit should be locked and kept in cool, dry places and out of reach of children. Keep at least one first aid kit in your home. Your first aid kit should contain following items: 2 pairs of sterile gloves. Gloves offer protection for both victim and the rescuer while treating open wound. Sanitizing agent. Mild antiseptic solutions can help to clean and disinfect the wound. Cotton. Cotton is used to clean the wound. Adhesive tape and gauze. These both work together to stop bleeding. Apply sterile gauze to a bleeding wound using firm but gentle pressure. Once bleeding has stopped, you can use the tape to hold gauze in place. Antibiotic ointment. Using antibiotic ointment on cut or wound helps to speed up recovery. Scissors. Scissors are used to cut bandages. Band-aid. Band-aid are applied on small cuts. Crepe bandages. It is used to support joint injuries. Along with this, you should also have thermometer, BP apparatus, medications such as painkiller, paracetamol, antiemetic medication for vomiting, antidiarrheal medications to treat loose motion, antihistamine drugs for allergy, any painkiller spray or ointment such as Move, Iodex, Vicks, ORS packets.